Well, greetings, amazing students, and welcome back to this week's lecture. For this week, we are going to be discussing in a two-part lecture substance dependency and drug abuse. And in particular, what we're going to do is examine substance dependency across the lifespan. And what I'm hoping to do is bring to you some very tangible information related to categories of substances that I have seen over the period of my career have a very powerful impact on life development. So what we're going to do is at the beginning portion of today's lecture, we will focus on substance dependency, particularly in utero drug exposure, and focus our attention on alcohol in particular. Also in today's lecture, what I will do is also place a magnifying glass over opioid abuse due to the opioid crisis that we are experiencing in our country at the moment. Part two of this lecture will place an emphasis on cannabis and the legalization of cannabis, otherwise, as I'm sure you're familiar, marijuana in this country, and considerations to have regarding the legalization of marijuana. And so, again, something that's very timely, something that's happening now, is what I'm hoping to bring to you. For the sake of today's lecture, I'd like to go ahead and focus our attention on alcohol abuse during pregnancy. So as we stated in previous lectures, in utero drug exposure, particularly when we're discussing usage of some heavy-hitting drugs, can severely impact the neurodevelopment of a fetus, right? And we talked about earlier in this class and other sections, methamphetamines and cocaine in relation to the forming of the amygdala, the neocortex, and things like that. For today's lecture, we'll be focusing on alcohol. And it's important to note things like chronic alcohol abuse during pregnancy is defined as the ingestion of 2 or more drinks per day, 2 or more during pregnancy. It's associated with increased rates of spontaneous abortion, higher rates of low birth weights in infants, placental abruption, increased perinatal mortality, ammonites, and threefold increase in preterm deliveries. So all of these things as a result of alcohol use during pregnancy. Fetal alcohol syndrome, or what's referred to as FAS in particular, we're going to focus on today, is the only cause of mental retardation that in theory is entirely preventable. It affects about 1 to 3 of every 1,000 newborns in our country, with another 3 to 5 per 1,000 exhibiting less severe fatal alcohol effects. And so alcohol usage in particular is up in our country for several reasons. One often finds that the more difficult societal pressures are, for whatever reasons, if divorce rates are high, if unemployment rates are high, in times when we have a pandemic going on like we are currently, or if there are other factors such as the social unrest that we're experiencing due to racial tension within our society now, alcohol use always increases. In fact, usually the worse things are, the better alcohol and tobacco sales are. Okay, so something to consider. We have found that 30% to 40% of the offspring of women who abuse alcohol exhibit fetal alcohol syndrome, or FAS, which was associated with both chronic heavy drinkage and binge drinking. We're going to talk about some of these terms related to FAS and binge drinking in this lecture. There's a reason in particular why I'm choosing to discuss fetal alcohol syndrome in reference to this class. And one of those many reasons why is because I have some direct experience working with children who also were diagnosed with fetal alcohol syndrome. As I was stating before, FAS in the previous slide is the result of the woman drinking alcoholic beverages, binge drinking during pregnancy. And as a result, alcohol has a direct impact on the neurological as well as the physiological development of the fetus. And so these consequences of drinking not only impact the fetus and the newborn baby, but also follow an individual's development throughout their lifespan. There are some physical symptoms that we can see related to FAS. I've worked with children who have exhibited some of these physiological symptoms, It's important to understand that not all of these symptoms may be present when serving a child or examining a child who we suspect may have FAS, but it's also important to discover or to realize that several of these could be present, these symptoms. Things like a smaller shaped head, right? Folds in the eyes may look a little different from other individuals, okay? Flat mid face here in area of the cheek, okay? Smooth, okay, upper front lip here, okay, with the philtrum. And so that notion there is usually there's like a little bit of a bump, and you may see that, not see that present, sorry, here with an individual with FAS. Low nasal bridge that you can see, smaller eye openings, things like a shorter nose compared to the proportionality of the face as a whole, thinner upper lips, almost sometimes, non-existent in terms of what the lip may look like up there, and an underdeveloped jaw. So these are some of the physical symptoms. I have worked with kiddos over the course of my career who exhibit these symptoms in their physiology. Now, later, what we're going to also discuss, though, here are additional behaviors, or symptoms, not only related to physiological symptoms, but also to behavior, impairment of development, all of which are extremely pertinent to development across the lifespan. So here are a list of other complications related to FAS, in addition to these abnormal facial features, right, which we've discussed, and small head size, overall shorter than average height, lower body weight, poor coordination, hyperactive behaviors. And so we're moving into more of a behavioral sort of symptoms and things here. Difficulty with attention and memory, and also including learning disabilities and disabilities in school. At times, we will see speech and language delays. That was common in the kiddos that I was working with, in addition to low IQs or impairment regarding intellectual ability. We have also seen kiddos experiencing or exhibiting poor reasoning and judgment skills who are also concurrently diagnosed with FAS, as well as sleep and sucking problems as a baby. Vision and hearing problems are experienced, along with problems related to the heart, kidneys, or bones, and nervous system abnormalities. So sometimes you will hear folks in our culture describing alcohol use as something to be very casual and lighthearted. And sometimes it's hard to really appreciate the gravity of the situation, the impact that alcohol has on our bodies, since it's marketed so heavily to so many different crowds. So alcohol is marketed to younger crowds. It's advertised to those of higher incomes. Drinks such as wine coolers, spritzers, and things like this are being advertised as drinks to drink in certain settings, times of the year, weather, social gatherings. And so alcohol is so heavily marketed that sometimes we lack the appreciation of how severe its usage can be, not only to older adults, okay, grown adults, but also to a fetus and an infant, okay? Now, it's important to understand that when we discuss alcohol abuse in particular, that drinking levels are specifically defined, and I'm pulling these drinking levels as defined by the National Institute on Alcohol Abuse and Alcoholism. Now, again, I'm sharing this information because some of you may have heard several of these talks before, particularly related to warnings and guidelines for young adults, college students, young adults just out of college, when discussing alcohol abuse. But I'd like for us to take an examination from a different lens related to lifespan development. So let's examine what constitutes, moderate, binge, heavy alcohol use per these guidelines, as it would impact an individual in their lifespan development, okay? So, according to the National Institute on Alcohol Abuse, all right, moderate alcohol consumption, all right, is referred to as moderate drinking of 1 drink per day for women and 2 drinks per day for men. Now, it's also important to understand that what constitutes a drink, all right, varies based on the type of alcohol that you're drinking, right? Obviously. So beer is going to have a different volume, right? Fluid ounces volume of what's considered 1 drink, such as 12 fluid ounces, as opposed to your harder alcohols such as wine or liquor or spirits. And so the Higher the alcoholic content of a drink means the lower quantity per fluid ounce that constitutes one drink. So that's important to understand. Binge drinking in particular, all right, is defined as 4 drinks per women or 5 drinks in men in about 2 hours. And so some will say, well, I'm not drinking a whole amount, like I didn't drink an entire 6-pack. But binge drinking is when you are also drinking that alcohol very quickly. So your liver and the rest of your body is processing that alcohol at a faster rate. So this is drinking more than your daily allowance of drinks, and it's also doing it in a very concentrated period of time, a brief period of time. Okay, and so another thing to consider is binge drinking is also constitutes 5 or more alcoholic drinks for males or 4 or more alcoholic drinks for females on the same occasion, means at the same time or within a couple of hours of each other, and on at least one day in the past month. Typically, what we're seeing now is there is a larger concentration of individuals who don't fall under the category of necessarily drinking more frequently, but they tend to drink in binge quantities. It's important to understand that binge drinking still has the potent physiological impact on your body, whether or not you're drinking only once on weekends and you're drinking large quantities, or if you're drinking little amounts throughout the week. It's just as dangerous. And so what's important to understand here is most folks now who engage in social drinking may not drink on a Monday through Friday basis, but then on Saturday and Sunday, they're drinking heavily and engaging in binge drinking per these guidelines, which is just as devastating on your body. Heavy alcohol use, okay, includes binge drinking on 5 or more days in the past month. Okay, and so that can be heavy, right? Binge drinking is heavy alcohol use there. Now, low risk drinking is defined as no more than 3 drinks on any single day and no more than 7 drinks per week, okay? And so you notice then this is what we're talking about for women now, okay? For men, it's defined as no more than 4 drinks on any single day and no more than 14 drinks per month, more than 14 drinks per month, okay? Sorry, per week. I'm sorry. Let me clarify that. 14 drinks per week. Yeah, that can be a huge difference there, right? So what's important to understand is what is recommended, all right, obviously, from the NIAAA, all right, regarding binge drinking or drinking levels doesn't always line with what our society tells us is considered normal for drinking, right? Much of the time when we look at advertisements throughout society, we're seeing that drinking, every time you go to the beach, every time you go to a nice restaurant, every time you are stressed, every time you want to celebrate, is normal. And so it's often portrayed that drinking is a natural sort of occurrence, if you will, throughout multiple aspects of our lives, nearly on a daily basis. What science tells us is that drinking in high qualities here can have drastic impacts on our health, our lifespan development, not only at the infant stage, but even later on throughout life. And so it's just important to keep these in mind as we continue. Now, while we're along the line of substance dependency and in that discussion, what I also want to do is highlight the notion of what we refer to as neonatal abstinence syndrome, or NAS. This is when, okay, a baby withdrawals, okay, from certain drugs he or she is exposed to in the womb before birth. And when you take these drugs during pregnancy, they can pass through the placenta and cause serious problems for the baby. So we know that when a mother is drinking alcohol, that substance, the alcohol, does pass through the placental barrier and impacts the fetus. Same thing with other drugs such as opioids, cocaine, and meth, okay, as well as nicotine. All right, so it's important to understand that I have worked, for example, with infants who have been born withdrawing from methamphetamines and in particular cocaine and opiates. A infant who is literally withdrawing in front of you is not a pretty picture. And what's really devastating to know in working with infants who have been in utero exposed and who are now battling NAS, okay, is that specific medical attention needs to be given to those infants as they are withdrawing from those substances, and also the impact of that child's physiological, emotional, psychological development has yet to be seen throughout their lifespan and will require close monitoring in the future. The next four slides that I take you through are going to focus on the current opioid crisis that we are experiencing in our country. The reason why I wanted to, in particular, to address this issue is because opioid abuse in our country has become so pervasive that it is very hard to find an individual whose life has not been impacted by opioid abuse in some way or fashion, whether it's directly or indirectly. It is not uncommon in which the clients that I serve throughout my career have been themselves battling an opioid addiction, or are very close to developing an addiction as a result of some unfortunate factors that have plagued their lives. What's really important to understand are some of the key indicators of where this opioid addiction came from. And so I want to start with a history of the opioid crisis and then move into some other statistics related to the degree of severity of this addiction. And this will end our lesson, our area of focus for today's lecture. So in the late 90s, okay, pharmaceutical companies had reassured the medical community in their research studies that opioid pain relievers were not addictive. And they said, so these opioid-based drugs, okay, based from opium, okay, are amazing in terms of addressing pain with our clients, but you also needn't worry, they're not addictive. So healthcare providers began to prescribe painkillers, opioid derivatives in particular, at an increased rate. Some of you may be wondering what opioid derivatives are. I'll be sharing that with you in a second, okay? Widespread diversion and misuse of these medications became prominent because they were being overprescribed. And in 2017, more than 47,000 Americans died as a result of opioid overdoses. In that same year, it was estimated that 1.7 million people in the US suffered from substance abuse disorders related to prescription opioids. About 652,000 people suffered from heroin use disorder in particular. Heroin, okay, is an opioid, along with several other drugs that are prescribed by doctors, okay? And so there's a process to this that I'm going to describe in terms of addiction. Some people believe that all heroin users started as heroin users, and as a result, they made a series of poor choices which led them to be addicted. But that's not necessarily the case. That's not what we're seeing in regards to the opioid crisis. Some general statistics to opioid crisis is every day more than 130 people in the US die overdosing on opioids. Now, here's where I was going to talk about the derivatives of opioids, okay? So current opioids associated with the crisis are drugs like morphine, okay? All of these coming from opioids, okay? Prescription pain relievers, such as Vicodin, Norco, codeine, and oxycodone, as well as Percocet. These are stronger versions of synthetic versions of opioids, okay? So they all fall under the morphine category. And these are just concentrated, okay? Now, heroin and fentanyl, are street versions of opioids. Well, fentanyl in particular also had clinical usages here as well, which are synthetic opioids that are even stronger than these listed above, these derivatives, 50 to 100 times stronger, in fact. If you even handle fentanyl patches, they can have a drastic impact. They can kill you, to be honest, through absorption through your skin. Now, CDC estimates that the financial burden of the US to be about $78 billion a year. And that includes costs related to healthcare, loss of productivity, addiction treatment, and criminal justice involvement as a result of the opioid addiction crisis in our country. So we are not only seeing alarming statistics about the use of these opioids, as they continue to be prescribed. All right. But what we're also seeing is a financial impact on our country as a result of battling this addiction. And of course, knowing me and my lectures, what I also don't want us to forget is the human impact of opioid addiction in our country. Now, normally I would do an activity with the group, with the entire class, and I would walk you through what this looks like in our class based on the number of students in the class. So please disregard these numbers at the end here. These don't apply to our activity for today. But here's what I do want to do is walk you through some of the statistics of the origin of some of this opioid crisis as it exists. Okay, so roughly about 21 to 29% of patients prescribed opioids for chronic pain misuse them. Okay, so let's say you go in and you have a real legitimate reason for being prescribed opioids. You are recovering from a surgery, right? You had an infection that was causing you a large amount of pain. You broke a bone, right? A severe bone that was broken. And therefore the doctor says, okay, you will need opioids to help address the pain that you're in. Okay. About 21 to 29% of those individuals go on to abuse those opioids. Now, between 8 and 12% end up going on to develop an opioid disorder, meaning now has become a problem that they are dependent upon this drug and unable to shake the usage of that drug. 4 to 6%, all right, of people who use prescription drugs, these were given to them legally at one point, will transition to heroin. And there's a few reasons why that transition takes place. Sometimes it's availability. So sometimes what happens is the doctor is no longer going to prescribe the opioids because, a year after that surgery, there's no more justification for pain existing. And the doctor is simply going to say, I'm not going to prescribe you these drugs anymore. Well, what happens is that an opioid disorder has already been set in motion. So as a result, an individual may seek opioid derivatives in order to maintain that high, that need for that drug, but do so without the use of a doctor's prescription. And so individuals will now begin seeking heroin on the street. One, it's affordable. The other thing is it's effective in maintaining that dependence on opioids. 80% of people who use heroin first used prescription opioids. This really breaks that understanding, sometimes that stereotype that all heroin users were just simply drug addicts and born that way or making a conscious decision. The problem we're seeing is 80% of people who had used heroin were first given an opioid legally. That's alarming too when we consider that opioid use described by class, race, gender, whatever the case is. In fact, we do see some startling higher rates of usage of opioids, both the legal prescribed as well as heroin usage and fentanyl in the suburbs of society. We do see individuals who have jobs, who are attempting to raise kids, who have careers battling with opioid addiction. And so that is also consistent with the opioid crisis in our country. Finally, I want to end on some addiction rates related to opioids. And so opioid overdoses increased 30% in just 1 year, or a little over that, from July 2016 through September 2017. And that was across 45 states, 45 states seeing a 30% increase. That's alarming, right? The Midwest region saw opioid overdoses increase 70%. Okay, from July 2016 through September 2017, again, a heavy hitting area of the Midwest being hit, okay, by opioid use. And opioid doses in large cities increased by 54% in 16 states. This is a phenomenon that we are seeing that has huge implications for generations to come, especially when we consider, right, as we discussed earlier in this lesson, the notion of neonatal abstinence syndrome, right, of children being born already exposed and withdrawing to opioids, and knowing that addiction can take generations at times to battle, to overcome. Where will our country be not only in the next few years in regards to our dilemma, our opioid addiction here, our crisis, but where will we be a few generations from now as a result of these trends? And so today I know that our lesson was a little short. So what we're going to do is we're going to go ahead, and that's because some of my previous lectures ran a little tad long. And so what I'm going to do is we will end here today for our lecture. We'll pick up with our centering. And then the goal will be is we will pick up with cannabis use and legalization as our discussion in the next lecture. Again, trying to bring you some content that is timely and relevant to what you will be experiencing in your future careers as well as in your future lives and your lives regarding substance dependency. All right. Okay, and what we're going to do is go ahead and close out with our centering activity for this lecture. Again, let's go ahead and make sure that our hands and feet are in a nice comfortable position. Let's go ahead and take a nice deep breath, right? And let's zero in on the fact that the information, although I covered it brief, I want to continue to remind us has a significant impact on the world around us. Many of us have known individuals who have or are battling an opioid addiction, who maybe are battling some sort of substance dependency other than opioids. It could be alcohol, could be other substances such as nicotine, tobacco, marijuana, right? And so there's a notion of where do we lean into our strength in a time of when we're battling addiction, right? Addiction, if it were enough to want to quit, we know that that would be effective, right? And so scripture brings us another notion of what self-control means. Self-control doesn't only mean, according to scripture, the ability for us to want to change, but to seek God first as a means of a higher power to give us the strength to actually change. So self-control isn't about only a desire, right, to stop depending on a drug or a substance, but also actually having the strength and the courage that comes from a deeper place, that comes from our spirituality in order to do so. And so today's scripture verse from Timothy, sorry about my voice today, allergies, from Second Timothy comes to us to remind us of this notion of where our power comes from, right? For God did not give us a spirit of cowardice, but rather of power and love and self-control, of power and love that results in self-control. How amazing is that, right? That we can rest that some of our control, our desire, comes from seeking God, which allows us to accomplish some of those very difficult tasks in our life. So that will be our scripture verse for today, and let's focus on this notion of self-control for our centering. So let's go ahead and make sure our hands and feet are in a nice comfortable position. Let's go ahead and try to block out all of those distractions and all those worries and allow ourselves to be present with God, who can speak what this notion of love and power means in reference to self-control within our lives. Let's go ahead and take that nice deep breath and close our eyes, and I will keep track of the time. Okay, and go ahead and take that nice deep breath. Go ahead and come on back. Welcome back, and I want to say thank you and goodbye, Mufasa. I don't know if there's any Lion King fans out there, but that one's for you. I want to say thank you so much for continuing to join the lecture. I look forward to part 2 of this discussion, where we will continue to discuss substance dependency as it pertains to cannabis usage, as well as an overall sort of overarching examination of what substance dependency does, right, to our lifespan development. As always, please be sure to check Blackboard for your due dates, your assignments. Please know that I continue to keep you in my prayers. I truly appreciate each and every one of you. If you need anything, go ahead and reach out to me, and I'm happy to connect with you. Thank you all so much, and I will talk to you in the next lecture.